absolutely delighted to introduce you to one of my good friends and colleagues, the amazing Dr. Floris, who works with me at MSOS and is also an anaesthetist. But Floris, how about you introduce yourself?
All right, thank you, Amanda. Thanks for the great intro already. So I'm Floris. I'm from Holland. I live pretty close to Amsterdam. When I introduce myself, I always struggle to say if I'm a sailor or a doctor, but I think technically in this role I will be a doctor. But one of my main passions is just sailing. So I've been sailing all my life with my parents, and then sailing dinghies later on, and doing a bit of professional yachting just after getting out of high school, and then moving on to more racing during my sort of limited time off for medical school. And so I went through medical school, finished that a couple of years ago, did the residency in emergency medicine, or like a sort of a year in emergency medicine, and then got into anesthesia training, currently in my ICU stage. So you can imagine quite interesting over the past few months with the pandemic going on. And also started training MSOS to combine my two passions, which are medicine and sailing, or at least, boats and remote locations.
Yeah, I must admit, you're a very passionate medical trainer. You're awesome, if I do say so myself. So what do you like most about marine medicine? What really excites you about it?
Yeah, I think the challenge, of course, the risks, you run into. Well, you might not call it an extreme sport, but it's, especially sailing with all the other things we get now with the toys we have. There are certain risks. And the real challenge, I think, is that it's the last kind of remote medicine. Even on top of some of the world's highest mountains, a helicopter can still come and get you in a few hours. In a plane, the plane is usually able to land pretty quickly, at least in a few hours' time. But after a day's sail away with modern boats doing over 200 miles a day, you're alone. There's no helicopter that can come and get you. Maybe there's not a ship with a really tricky transfer to transfer you to a higher rate medical facility. But other than that, you're on your own. The closest to you is the ocean floor. So you got to deal with it. So you got to teach, you got to know the basics, the practical side, because you're the one that needs to be doing it. And then you can take a bit of time or discuss with doctors on the other end of the phone what you should do. But you really need to know what you're doing and know the practical side, and need to be able to deal with the first few minutes yourself. And that's the real challenge. Why it's so much above normal sort of rapid response courses and medicine.
Absolutely. And we were discussing, Floris and I are actually in Spain together running a really cool program at the moment. And we were talking earlier today about you were telling a story about a situation where there was a boat, it was a long way away from shore, and they had to stabilize a femur fracture, the femur being one of the biggest bone, the big bone in your leg, one of the biggest bones in your body. And, if you're a long way away from a decent hospital, that can be catastrophic. And the crew did such a good job that they couldn't even find the fracture when the person got to shore. Can you expand on that story? Because I think that really explains the importance of good medical training and why we should keep up to date with it, and how effective it can be when done properly.
Yeah, so in that case, the fracture wasn't actually able to be seen from the outside. So with taking a proper medical history and knowing what they've learned over the years with their medical training, they recognize something is not quite right. This is not going to resolve by itself. This really might be a fracture. This is not just a soft tissue injury. And so they decided to treat it like you would do with a femur fracture. But of course, they knew they were at least 5 days sailing away from appropriate medical help and appropriate evac. So they had to manage it by themselves. So they had to use something else than just a splint, because that was not gonna manage it for 5 days. That's only sort of a short-term transfer management. So they thought about, what should we do? So they used a really old system of actually managing conventional management of big bone fractures, which is sort of traction. And the whole idea is that you just you put some weight on the end of the limb, and you do slow traction over days with a weight, free hanging weight, slowly reducing the fracture, getting it back into place, protecting the vessels and the nerves that sit around it. And by that management and really close management of the patient with appropriate pain relief and appropriate nursing care, even, you know, for 5 days in a bed. Think about, how do you go to the toilet with such a traction splint on, you know? So they use sort of old school medicine with new technology, with speaking to doctors on the shore, etc., how to manage it. And that way they manage to treat the patient and keep him safe, keep him alive, keep him out of pain, and actually treat the actual injury.
So cool. And then what happened when they went to shore? He had an X-ray?
Yeah, so he had an X-ray, and then the guys there said, well, we don't see a fracture, so you're fine to go. So he spoke to his insurance company saying, well, I would like to go home from wherever I am. You know, this is not where I was planning to land. I need to go home. So I said, oh, it's okay, we book you a ticket, and they made him go into normal economy. But he still wasn't really able to sit properly, so he was still in a lot of pain. So by the time he got back to his home country, it's like, this is still not right. He needs to get another X-ray, and they did another X-ray, and they still couldn't see the fracture. So like, no, you're fine. And then another 2 weeks passed, and then he went again to the outpatient clinic where he went to first. He was like, doctor, there's still something not right. I can still not walk on the leg. And they actually made a CT scan, and then only then they saw the fracture. Which luckily healed okay afterwards with proper immobilization and relatively minor surgery. But yeah, it could have been worse. It could have been dislocated on the plane again after, you know, only 5 days. A fracture is not so stable that you can walk on it.
Yeah, it's incredible. I love that story, and it just shows how effective medical training can be when, you know, especially in remote locations, that we can make such a difference. I mean, that guy could have possibly lost his leg if it hadn't been treated so well. So in terms of the medical kits on board, what equipment excites you the most? What gets you really excited?
Which gets me fired up is the tourniquet, as you will find out. But that's maybe more from a negative side, because unfortunately I've seen it used a lot for the wrong reasons, and sort of not being aware of what you do with it, and what the point of doing it is. Yeah. Actually, maybe there's nothing that's actually in the kit that excites me the most. It's actually explaining in the training the basics that even without the kit, you know, or even with whatever item you have in the kit or on the boat, as long as you think about the logic behind the injury and what you should do, you come a really long way in the first few minutes and hours. So think about burns. You know, we have all these fancy gauzes, etc., in the kit, but there's nothing in the kit apart from maybe a good dressing that really cools you down the wound as well, because you don't have any water available or whatever. So there's a few of those in the kits when you are on the road or on the beach where you don't have appropriate water available. Is just think about the basics. Okay, I need to cool this for 10 minutes, 30 minutes. We talked about it yesterday for a long time. You can discuss however long you should cool with lukewarm water, but it's all about thinking about the injury, about the mechanism of injury, and about how to treat that with really basic mechanisms. But you got to keep thinking, and you got to go back to your training, and not going straight into the kits like, I've got this fancy things. We'll just put it on and we'll be fine.
Yeah, so important. And especially burns, because burns are a huge thing in yachting. So many fires and so many galley injuries. Well, Floris, it's been amazing having you on. We've got to get down and train some students.
Yeah.
Get into some hardcore medical scenarios. But I'm going to get you on the show again, because I think there's heaps of stuff we can talk about. Thanks so much. And
sure can. Thank you. Thank you for having me, and looking forward to our next chat.
Absolutely. Everyone, you've been watching Yachting International Radio, Inspirations with Vanda J. We'll see you back next Monday. You've been listening to Dr. Floris from MSOS, and we'll see you